Hello, this is Kerrie from Tuberose Healing, and I wanted to talk to you today about low back pain because that is no fun. So there's a lot you can do when you have low back pain, but I wanted to talk to you about a few muscles that kind of help you understand it and some of the things that we do to help give relief. There's a muscle called the psoas or iliopsoas. Actually, this one is showing you a group of 3 muscles. And if you look at this, you'll see one is the iliacus and 2 of them are the psoas with the P, psoas. But anyway, it attaches to the front of those lumbar discs. And then it comes forward through the body and attaches to the leg, the femur. Now, what's really interesting about this is that it's really, really deep in the pelvis. And it's very, very difficult to get to, but if there's a few techniques that you can do to relieve that. But if you think about it, those muscles are attached. Let me show you here. This was probably an easy way to see it. Here's the lumbar discs, and this is the front of the body. You know, people have the low back pain back in here. But here's the front of these lumbar discs, and that muscle I was telling you about attaches to the front of them, and then it comes forward through the body, and then it comes down like this, and then it attaches over here to the leg. But what happens when that gets tight is that it's triggered by being in fight or flight, by being in a hyper-stressed state. So what happens is the body torques, and one of those muscles gets pulled tighter and the other gets more loose, so it prepares the body to fight or run. So those tug on those lumbar discs and pull that forward, and it pulls those, in an odd way toward the front, toward the anterior, and then it can compress, and then one side gets compressed because I said the body's turned, so one side is going to get compressed more than the other. So that would definitely hurt, and if you're trying to walk, one side would just constantly wear more than the others. So that would have to be relieved, and that relates to kidneys. That's on the kidney meridian. It relates to kidney muscles, so we'd have to look at that as well. Are you filtering your water? If you live in most states, there's a lot, especially in Florida, there's a lot of calcium in our water, so that calcium is inorganic, and it likes to, your kidneys are your filtration plant, so it's constantly trying to filter that out. If you know what I mean by running your hand along the bathtub or your sink and you have that white film, that's calcium. So that gets deposited in the kidneys and then the ureters and can cause problems. So a lot of times you might associate low back pain with some kidney issues. Also, I was telling you about the fight or flight. So that involves the adrenals and the fight or flight or the stress. And when you're under lots of stress, and it doesn't have to be heavy stresses. It can be psychological. You could be anemic. You could be hungry. You could be tired. You could be undernourished. Those are all stresses on the body. You could be dehydrated, like most people are. So that creates a lot more problems too. So back to low back. There's a couple of other muscles I wanted to show you, but that one's really important because that oftentimes is a big culprit. Another one is in the back. This one is called the quadratus lumborum. And you're looking at the back of the body, and it's connecting deep in here, and you can see that it's going to the top of this hip bone and then along those lumbar discs. So that can get tight and pull as well. That's that right in that middle of the low back down in here. So that one, and then this other one called the sacrospinalis. It runs the whole length of the spine, all the way up to head, all the way down. So these muscles can get tight, contracted, and need to be relieved. Some things that you can do at home. I love to use this Ancient Minerals Magnesium gel. I like the gel better than the oil, but because it's more concentrated, the oil though is it's good for putting like on a cotton or a piece of gauze, and you can soak it. You can put it on the muscle. You can put it on the low back, and it will absorb in and relax that tissue. A lot of times those muscles are really tight, and it has to be relaxed. And then you can get some kind of a massager. This one is called the Pure Wave, and it has a knob here, and then it vibrates and you can get in and work on those low back muscles yourself. You know, you can reach back behind, up and down. Something like that is really good in between visits. So I hope that helps, and if you have low back pain, remember those few things, and thanks for watching. Bye-bye.